Okay, Maureen, we are live now.
Welcome, everybody. I'm excited to spend some time with you this morning thinking about career advice. And we've got some incredible panelists with us here today. Each one of us going to tell you a very brief story about our careers, but hopefully have a very exciting chat with you about questions you might have at this point in your career. So I am Maureen Buzignano. I'm the President Emerita of the Institute for Healthcare Improvement in Boston, Massachusetts. And I welcome all of your questions. I would recommend that you go into the chat section on the right-hand side of your screen and type in any questions that you might have for this great panel. Our panel today is, in addition to me, is Peter Johnson, Bongi Savanda, Yohis Ortega, Erica Burton, Amna Amadi Zeda, Menashe Zika, and Carrie McCarthy. We're each going to tell you a little bit about our very different journeys and then open it up for a conversation about your potential and your future career. As I mentioned, I started my career as a staff nurse and went to work in operating room and ICU. And I found that I had a lot of ideas about things that could get better. And I found that it wasn't easy to express myself. So I learned very early on that communicating in different ways, sometimes reaching someone's heart, sometimes reaching their mind, reaching their wallet, could really help me to get my points across. And I was able to make some of those. I then was asked to become the chief nursing officer of the institution where I was working. And then I became the CEO of a hospital at 34. I went on to work and set up an international consulting company. But in the past 25 years, I worked with Don Brewitt as we set up the Institute for Healthcare Improvement globally. And I've, for the past few years, been retired, but I'm finding that in retirement, there's actually more activity and more opportunity and more excitement than I've ever had in my life. So I welcome the chance to work with all of you. We just had a great session on the importance of mentoring, and that's been a wonderful experience for me. But I want to go around quickly and hear all the different experiences that we've got in the room. And Peter, why don't we start with you?
Had to unmute myself. Hi, everybody. I'm Peter Johnson. I'm currently the Senior Director for Nursing and Midwifery at Chicago, an international NGO, and have done most of my work over the past 15 years supporting nursing and midwifery in low and middle income countries around the world. And let me go way back to the very beginning. I was an 18-year-old when I really first saw nursing as an opportunity. I was in the United States Air Force and military, young recruit, and one of the things the military in the U.S. does really well is that they have great mechanisms for selecting people for potential career fits. And I got selected to work in the military health system, and essentially as a nurse's aide, what they call a medical technician. But that gave me the opportunity to work alongside nurses and be mentored by nurses who were commissioned officers in the military, highly respected, doing work that I saw as very valuable. And that changed my life. I got out early, went to nursing school, came right back into the Air Force as a nurse. And then had an opportunity. I was a new father at the time, a young father. Had an opportunity to work with midwives, and I realized that was the next phase of my career calling. A few years, maybe a decade later, armed with a master's degree in nursing administration, I became a midwifery program administrator. And then I remember one day somebody calling me and saying, "We need a teacher to start a midwifery, to be part of a new midwifery education program in my community. And I remember walking down the hallway in my scrubs, thinking to myself, who do I know that could do that well? And I thought, me. And I embarked on a new career as an educator. 5, 6, 7, 8, 9 years later, I don't remember what, had this opportunity to do global public health. And again, armed with no public health background, said to myself, well, I could do that. And so I think the lesson learned for me, as I am on the cusp of my retirement also, is that you don't know where you're going to be when you grow up, and enjoy, it's really quite a journey in nursing.
Thank you so much, Peter. And I've had that question asked so many times to me from young nurses who say, how did you plan your career path? And I said, you can't. There's no way you will ever know where you're going to end up. You just have to realize that when a door opens, sometimes it takes a little courage to walk through that. Or as you say, to say, I could do that. Bongi, how about you? Do you want to join us next?
So, hi everyone. It's such an exciting time to join you and to share my journey too with you. So I'm Wanda, and I currently work as an independent nurse consultant in advanced practice, particularly within primary care and unscheduled care, so which is the bridge between emergency and primary care. I'm also an educator, and I have a very strong interest in interprofessional education and collaborative practice. My doctoral work is focused on researching those areas in advanced practice, so health policy and educational leadership. To take you back, when I was 17, when I started my nursing school in Zimbabwe, Bulawayo, the second city of Zimbabwe, and I trained at Mpilo School of Nursing and graduated in 2000. So I worked primarily in mental health, pediatric mental health, and then I moved to ICU. And just after a year of graduating, I realized that I actually was a bit of a rebellious nurse who didn't want to accept status quo and wanted to be as diverse as possible, which the nursing profession wasn't giving us. But I wasn't going to move away from nursing because that's what I was committed to do and that's what I love doing. So I went into research. I was a research nurse for a year before relocating to the United Kingdom. Been practicing in the United Kingdom for 16 years and I still practice in Zimbabwe. So this is where I am at the moment, and this is where I work both clinically and in education. My work, although focused on advanced practice nursing, my advanced practice work involves leading and facilitating other professionals as well, including clinical pharmacists, allied health professionals, so physiotherapists and paramedics in developing their skills in advanced practice. And in 2018, I led an Anglophone Africa APN policy document that we did in collaboration with other key stakeholders, including JPICO and including the American Association of Nurse Practitioners and the ICN APN network. We submitted that in 2018, where we're proposing on the way forward in policy dialogue in Africa and how we can move forward really with establishing appropriate programs that meet population needs. I am excited to say in 2020, this is part of the guidelines in the APN 2020 guidelines. So you can see about our work there, and we're so excited. Our next stage is to move to the framework for the family nurse practitioners. So I'll be really excited to hear from you young nurses, especially those from Africa who are interested in advanced practice programs.
Thank you so much, Bongi. Isn't it funny how we're all connected globally somehow? It's wonderful to see the connections. And I love that we're coming together in this way. I hope we all stay together going forward. Yohis, how about you?
Hi, good morning, everyone. First, I want to thank for the invitation. When I go back to my goal, I'm currently an Associate Dean for Hemispheric and Global Initiative at the University of Miami School of Nursing and Health Studies. I'm also a nurse practitioner certifying family, emergency, and acute care. Going back to my first steps, I have to go back when I was 21, that I migrated to the US. That's why you feel this strong accent. And I can speak for an hour, but I won't. about all the challenges and the obstacles that I have been, to go through to be where I am today. First, I just want to take 1 second because someone from the chat that meant a lot to me, that was one of my initial mentors. When I went to nursing school, she could even tell you now how my English has improved than when she met me, Dr. Louise Marshall. And I look forward into her. She's enjoying this call, and I haven't heard from her for years. But anyhow, I went to nursing. It was hard for me. I came to this country and I started as a waiter to be able to pay for my school. And I did the best I could, even sometimes missing questions because I didn't understand what the question was asking me. And one thing that is there, you never stop and you always keep educating yourself and looking for the future because you have to believe in yourself. So I graduated from nursing and all my career have been in the emergency room. I came back for my master program. And when I finished my master program, I never forget, similar to Peter, that I was approached by my dean. And she said, I need someone to teach pathophysiology because the students are not doing well. And of course, that's the class that this person, Dr. Louise Marshall, taught me that it really marked. So I was happy enough to teach that class for 5 years, and I started in the nursing education career. And I started developing an international program from which nowadays I have an NIH grant to train new nurses, concentrate the research in health disparities. So I really enjoy educating, and I have also, for the last almost 8 years, get enough funding for students from disadvantaged background, from health disparity students, to come and give a scholarship for them to complete advanced practice nursing. So I'm very happy to support, probably the support that I didn't have. I'm happy to have it to people that I can help nowadays.
Thank you so much. You made me smile because I'm the oldest of 9 kids. And so when I went to nursing school, it was $300 for tuition, room, and board, and I still had to take out a loan and work part-time. It's very exciting to hear from everybody, and especially how you branched out from your earliest thoughts about nursing to education and research and global midwifery and the like. Erica, how about you?
Hi, thanks. So I am speaking from Toronto, Canada, where I work as the senior advisor for the nursing and health policy team at the International Council of Nurses. I was just thinking back around this time. I was 10 years ago. I was passing my RN exam. So about this week, 10 years ago. So that's pretty exciting. When I graduated, I started off, I think as most nurses do, at the bedside. I started in intensive care in an ICU unit. And I quickly realized that that wasn't for me. But I had a lot of shame around sort of leaving what was always told to me as sort of, the career path of a nurse. And so I felt like I was giving up, that maybe I wasn't supposed to be a nurse. And I thought, what the heck do I do now? Through networking, which I'll, could go on and on about its importance, I started at the public health unit in Ottawa, which is the capital. And I started on a topic that I found a lot of passion in. So it was sexual and reproductive health and harm reduction. So I worked as a public health nurse through a fantastic sort of new nurse graduate program. And I did that for about 3 years, at which point another life decision took me to Geneva. And so here I was sort of back at square one. The Swiss would not recognize my license or my degree, despite being from, educated in Canada. So I thought, what do I do now? And so at that point I turned to education and started my master's through a fantastic program at the London School of Hygiene and Tropical Medicine. And then from there, that just opened up like a whole slew of opportunities. I started working during the Ebola outbreak with Doctors Without Borders, or MSF, looking at the comings and goings of expats working in the missions. And then I did little bits and pieces around Geneva with, sort of the limitations of my Canadian license. And then I got this fantastic opportunity, again through networking. Someone who I had known from Canada who was working at ICN at the time said, hey, you volunteered here a few years ago. I'm wondering, we have a position that's opening. You might be interested in applying. And so that, has led to present day. I never thought that I would be working in global health policy when I graduated 10 years ago. What I've also done is sort of refound my passion for clinical nursing as well. So 2 years ago, a year and a half ago, I went back to clinical nursing sort of part-time on the side of ICN. And I work in an organization called Casey Health, which is Canada's very first hospice that opened in 1988 for people living and dying with AIDS. So at that time, it was definitely a palliative care place, but now it's grown into this beautiful community hospital. So I'm able to do both of these things, which are extremely complementary to one another. The global policy absolutely complements my bedside working and vice versa.
If everybody can mute their microphones,
which are extremely complementary.
Yeah, how can you, Hannah?
If everybody can mute their microphones, which are extremely complementary.
Go right ahead, Erica. Thanks. Can you hear?
I can. I can still hear sort of myself playing on repeat.
Oh, it sounds perfect to me.
Oh, it does? Okay.
Yeah.
I can still hear it, I think, from Hannah. That's better. Yeah. There we go. Great.
Okay, great.
Yeah, so here now I find myself at ICN and as you said, we're all connected, working in just a fantastic network of nurses and of people in a subsect of nursing that I never even knew existed when I started my program. So yeah, that's a little bit about my path.
Thank you so much, Erica. I love that you were able to share some of the insecurities about the different decisions you made. I think we've all had those. People call it the imposter syndrome or all kinds of things. But the fact that you found a place that you were working and you didn't feel so comfortable, so you said, I want to go and have meaning in my life by changing jobs, that's fantastic. And I love that you displayed that courage a number of times. You've already worked so many different places. It's such a difference. I think it's an amazing experience to have. Amna, are you ready to go? Maybe we'll come back to you. Amna, are you there? How about Minshi? We'll go to you first.
Okay, sure. Thank you so much, Maureen. And I would just like to say, it's really amazing to be able to be on this platform with so many people that I regard as mentors of mine. So it's really been great to be able to hear some of their stories and seeing how they've progressed within the profession. So my name is Anika. I'm a young nurse from Harare in Zimbabwe. And growing up, I always was involved within my community. I always knew that I had this passion for health. And within my community, I was always the one who was running blood drives as school initiatives and organizing community outreach programs. So I always knew that health was my path. And at the end of high school, that's when I realized that nursing was for me. So I trained in nursing at the University of Zimbabwe, and I completed my nursing degree in 2016. And throughout my education and throughout nursing, I always had this, I continued my passion for community. And I remember I really enjoyed community health nursing as a topic and as a subject because I felt I could identify a lot with it. And considering all I had been doing and all I had been involved in within my community, it really always felt like my path. So throughout college, I was the president of our college Rotaract Club. I was the president of our Nursing Students Association, among a lot of other leadership roles. And then in 2016, I had the opportunity to attend this course in social determinants of health that was held in Uganda. And I think really that course for me, it's really helped in developing me as an advocate within health. Because it was through that course that I learned about a lot of the disparities in health and looking at a lot of the challenges beyond the biological basis of disease and illness. And coming from that course, it really brought me to have a lot of questions and to really start questioning a lot on a lot of things I had seen and through my training. And it also helped me orient as well and look at what I would want to do and how I would want to be able to contribute within health within my country. So I remember I managed to come together with a group of international other young nurses, regional young nurses that were in Africa. And we managed to create a body that is known as the Federation of African Nursing Students Organizations. And we were young nurses from 5 different countries. We were from Zimbabwe, from South Africa, from Uganda, from Rwanda, from Kenya, Malawi. And we got together and said, why isn't it that young nurses in Africa can be able to contribute and be able to provide solutions within our continent on challenges facing our continent? So through that interaction, they selected me to be the first chairperson of that body, and I was the president of that body until 2018. In 2018, I was selected to be a young nurse representative on the board of Nursing Now. And through Nursing Now, I have really had the opportunity to be able to interact with regional health leaders, global health leaders, who have really inspired me and really helped me see how a lot of development within health in Africa really comes through policy. So that has really been an interest for me. And it's an interest that I hope to develop further within my career. Thank you.
Thanks, Menashe. And your description of your career is really, I think, reflective of what's happened to the profession across the world. We've gone from my day of learning technical things to really looking upstream at the social determinants, and it's expanded so that we can have an influence on the development goals and on health and healthcare. And I love the description of your journey. Let's see, Amna, can you hear me now? Maybe we'll go to Carrie first and then back to Amna.
Hi, everyone. My name is Carrie McCarthy, and I work at the World Health Organization here in Geneva. And I am in the Health Workforce Department, and I am the focal person for nursing and midwifery workforces. And let's see how I got here. My mother was a nurse, so I never wanted to be a nurse. But my mom was a nurse researcher, and she studied cancer in rats and mice, and that's always what I associated nursing with. So I was never interested in that. But I was interested in international work and humanitarian work, and I was in university at an orphanage, essentially, for abused and abandoned street kids in Bolivia. And there was a nurse who would come into that orphanage every so often and look at the kids. Listen to their chest, look at their eyes, know whether they were anemic, they had a wheezing in their lungs, and she was so competent, and I was just amazed, and I really wanted to do that. So I went home and I changed all my courses at university to be pre-nursing courses, and really felt like nursing was my way to do work internationally and work with underserved populations. And so that's what I saw nursing as my vehicle to doing. So I did a nursing degree in the United States, and then I graduated and I went right to the office of Doctors Without Borders, and I said, I'm ready, give me a job, let's go. And they sent me back and said, you need to get some experience first. So I went and I worked in the US in a clinical setting, emergency room in an inner city Chicago US hospital. And then as soon as I was done with the requisite 2 years, I went right back to Doctors Without Borders, and I actually didn't do work with them, but I took another job with another humanitarian relief organization in Iraq. And so I went right into Baghdad in 2003. And I expected to be doing clinical work. I packed only scrubs and I was ready to work with whatever came at me. And I ended up working with the Ministry of Health in Iraq with a nursing division. And nursing had always been a really suppressed profession in Iraq, but now they had this moment of opportunity. So I was working with the ministry, and I was just amazed at the work that those leaders in the ministry did for nursing and really what they were trying to achieve. And I realized that population level health was actually really sparked my passion as opposed to clinical nursing. And so after that year in Iraq, I went back and did a master's in public health. And ever since then, I was really always at the intersection of public health or global health and nursing, and that's sort of where I stayed. I did more work in Afghanistan and Pakistan and another year in Africa with Doctors Without Borders, and I finally decided to settle down a little bit, get a PhD so that my options were a little broadened in terms of the kind of work that I could do. And I was really interested from my work in Africa, looking at, again, the role of nurses in providing services to underserved populations. And this time I was kind of front and center with the HIV pandemic in Africa and how nurses were doing this expanded role, but without the regulatory backup in terms of education or licensure or continuing education around HIV service provision. So I actually did my PhD looking at that. And then I did my doctoral research in that area. And then I worked for the US Centers for Disease Control. That's where I did my doctoral research through the PEPFAR program. So I was in global health within a US government agency, and I stayed there for about 5 years in the health systems, strengthening and human resources for health team. And then I worked with people in WHO in that capacity. And now I'm with WHO just a little over 2 years now in Geneva in the Health Workforce Department. And my area is essentially the Year of the Nurse and the Midwife that we worked on with member states of the WHO to get to have come to fruition. And I was a lead author on the State of the World's Nursing Report. I'm working closely with UNFPA and the International Confederation of Midwives on the State of the World's Midwifery Report. And we'll also be working hard over the next 6 months on the next global strategic directions for nursing and midwifery. So it's a really exciting time now to be at WHO, especially with our Chief Nursing Officer, Elizabeth Ero. And of course, I get to work with a lot of great people on this panel through my work at WHO. So I'm happy to talk with young nurse leaders and excited to hear questions and have discussions. So thanks for this opportunity, Maureen.
Thank you, Carrie. I love that you are focused on the nursing workforce. This is the first time in history we have 5 generations in the same workforce. And people come at this job with very different expectations. I really think we need to thrive, and that's what I'm excited about the Year of the Nurse. Mm-hmm. Amna, can you hear me now?
Sorry for the delay. I was having technical problem. I can't hear you that time, but now it's fine.
Great. So would you
Yes.
share 3 minutes with us about your career?
Yeah, my name is Amna from Qatar, from the Middle East. Our nursing here in Qatar, our population more about expat. We are only 1% of total nurses from the 99, very less. We have only one male Qatari nurse in Qatar. The other all females. When I joined nursing, there is a resistance from my family, as usual. You know, like for us, the nursing is not that good job here in our pop in Qatar. But we like nursing. I like nursing. We were having only diploma in nursing that time when I joined in 2000. I had my diploma, and then I continued my BSN. Our country opened for us the Calgary University of Nursing here in Qatar to post diploma to get my BSN, and I continued my BSN. Me and my colleagues, all Qatari ladies, we tried our best like to advocate and ask the people to join nursing here, that to show them how much is important is nursing. It is not about only, you know, the people perception about nursing everywhere. So we want to show them that the nurse not only limited for vital signs or injection, we are much more than that. We are going to schools, going to young age, pre-graduate, inviting them to join our nursing. Thank God we have a very supportive CNO, Dr. Anika. Since she joined us here in Qatar, she raised the profile of nursing. She supported us through joining the Nightingale Challenge. We went to Geneva last year, me and my colleagues, and it was really different experience. You know, she gathered all the nursing here in Qatar. We met each other, and about research. Now we are working on research and getting things to know everything happening around the world, which we don't know about it before. So this Nightingale Challenge also give us, you know, it's like now we are on roll in this challenge. We should do something, and we are on this. So I am very happy that this happened and to be part of it. I hope more Qatari nurses will join nursing, and especially this COVID. I know it is very, what happened, it's pandemic and all, but the people in Qatar now recognize the importance of nursing and doctors and medical profession more. The country is supporting us by everything, and they are even like supporting the student, that they will give them salary even while studying to be a nurse. They appreciate us, the military, everybody, they called us the White Army. And the first time, you know, this all recognition happened to us this year, the year of the nurse and midwifery and this COVID. So sometimes, you know, I am telling this COVID show the people the importance of being a nurse. We are like expand a lot, and thank God, yani, I am now with you on this. I'm very excited. Thank you for the
Thank you, Amna. It was great to hear you, especially I was there in Qatar last year when it was Nightingale Day. So I love being there with you and watching the nursing profession change. And I really appreciate you bringing up the COVID crisis, because I do agree with you in Doha, but also around the world, that it has changed people's perception of what we bring to health and healthcare. And even more broadly, it's been an amazing experience and a very painful one for, I'm sure, all of us. Yes. Thank you to everybody. We've got about 20 minutes left, 15 minutes left. And I know some of you have been writing in chats, and thank you for doing that. I also got a couple of questions that I wanted to ask. The first question was, what is the best piece of advice you could give me, or you would give yourself if you were able to speak to your younger self? And so, Yohis, you want to start off with that?
Sure. Well, going through the chat, that would be my answer. Education. You never stop learning. So you have to keep getting educated, get your right tools to be ready to be a leader. Don't give up. Okay, it is okay. It is okay to fail, and we have to learn from the mistake. But I think education will give us the tools to keep going, and of course, perseverance. Okay, don't stop. Keep learning, and it is not just about yourself. It is about what you can bring to the table and how many people you can benefit. So we cannot think as leader about ourselves, if not what we can do for others. Thank you.
Thanks, Yoas. Does anybody else want to join in on that question? Go ahead, Erica.
Yeah, I just want to echo what Yoas said, and a little bit about what Peter said when he described his career. Really about believing in yourself, and if you don't, try anyways. So, oh, hey, maybe I could do that. Really, I think confidence shines through, even though you might not feel so confident. That really shines through others. As well, Yoas said, don't give up. There will be highs, there will be lows. Both of those are expected. And so just be really gentle with yourself and be patient, and sort of that like self-love and gentleness will bring you really far. I think we're our own worst critic and we're really hard on ourselves. So I think I would go back, to me 10 years ago and say, just be patient and gentle, and that will shine through.
Thanks, Erica. I always say you can't give what you don't have, and we never nurse ourselves. But what you're saying is that if we don't take care of ourselves, we're not going to be in a position to give to others. I really appreciate that. Let's see. I have another question. Is when you were making career decisions.
May I take that one on just really quickly?
Go ahead, Peter.
I'm sorry, I was raising my hand. Young Peter 40 years ago was very argumentative. And very, very impassioned. And old Peter's changed through his career. But I remember arguing vehemently with my nursing professors that I shouldn't have to take any of the maternal health parts of the curriculum or certify for that as a nurse, because I was never going to do it. And my career has been focused on women's health and midwifery. So just, you don't know where your career is going to take you, and you are going to evolve.
Thank you. Anybody else want to jump in on that question? Well, how about this one? When you were making career decisions, what were your influencing factors? We've heard a lot of them today. The passion that you brought to a particular piece of work, or that your curiosity. I've always been a big believer in IQ, EQ, and CQ. IQ, you've got to learn, like Peter just said, even if you don't want to. EQ, empathy, and kind of walk in the shoes of our patients and their families. And CQ, curiosity. And I do think the more curious you are, the more you learn to ask questions as opposed to teach, I think the better. Anybody else want to jump in with that question? What influenced you?
Ken?
Go right ahead, Carrie, and then we'll go to Bongi.
Okay. I think I would say that it's a few of us alluded to connections and networks. And I think for me, it was really helpful to have different professors and role models that I could go to. And this started even identifying them in nursing school, trying to find a professor, for example, who had connections, for example, in another country that I want to try to do my clinical rotation in that, and kind of you never know what the opportunities you have until you start looking and start asking. And so, for example, in nursing school, a lot of professors were connections for me to a bit of a broader experience. And that was true even in, that was in my undergraduate work, and then still in my graduate work when I spoke with the dean of the School of Nursing when I was doing my PhD. And just kind of telling her what I wanted to do and to see what she thought. And it turns out she had these great connections with me in Atlanta and with the Centers for Disease Control. And that's where I ended up doing my doctoral research. So you have these people that are really resources to you, and trying to you don't know maybe who will be it, but when you start talking to people and you try to see what connections the people you know have, then it kind of broadens your own connections and your own opportunities. So I would say seek out those resources that you have, and then see what develops from there.
You know, you're reminding me, Carrie, that it might be helpful for young people to kind of make a little connections map, a little network map, all their passions, you know, and just say, well, I know I could call Carrie if I wanted to think about this, or you know, to start to map it out, because I think the points that you're all making about connections and networking are so important. And I didn't see that when I was young. I just kind of wove my path forward. But Wangi, how about you?
Sure, I just want to say, just build on what Carrie just said, really thinking about your networks, but broaden them. Don't think within the nursing profession, because that's what I have always done, to learn more about health policy, about legal issues in medicine and nursing. I had to work with solicitors. I had to spend time with lawyers. I had to work with my MPs. I had to work with the senators to help us with the APN policy. So think broadly as we move, particularly in the 21st century, nursing is becoming more complex and more dynamic. So think about other careers. How can you spend more time doing ITs, working with IT colleagues to enhance the EHR records that we're doing, or to do your clinical audits? And also see those people as role models as well, not necessarily in nursing, but outside nursing. Because as nurses, we know we're great at what we do. We know about each other, but the other people need to know as well, so that we're invited to those tables. That's what I'll say. And also, when you get opportunities for interviews, do interview your employer. Make sure that's an opportunity. You interview your employer. You will know an employer who will help you with your career progression, and who will help you to be actually innovative and serve your community as well.
That's a great comment, especially about interviewing your employer, because I think in some cases you can walk in and feel that this culture is supportive and development focused. And in some cases you won't find that, and you'll know where you want to grow. Anybody else want to take a stab at that? And thank you all for doing the chat. I do have another question, which is, how can I impact and make change at this point in my career? What advice would you give to somebody who's younger in their career about how to make an impact? I'll start and then open it up. When I was a brand new staff nurse in the ICU, I was walking always through an empty pediatric unit to get to a full ICU. And one day I came up with this idea that we could make a step down unit in the pediatric unit. And so I went to the CEO and I said, oh, I've got this great idea. And he kind of laughed at me and told me if I could convince the pediatricians to move out of the brand new building back to the old building, then I could have the unit. And of course, I went to the pediatricians meeting and they laughed at me. I went for 6 months, every month to the meeting, until they finally gave up and gave me the unit. But I learned that when you're trying to make a change, especially when you're young, you need to communicate in a certain way. I would tell a story to get to people's hearts. And then I would say, and I would extrapolate to the total population and say, it wasn't just this patient. It was, we had 20 others this week just like that. And then I would talk about the human cost and then the financial cost. So I learned this arc of getting to everybody, but it wasn't easy in the beginning after 6 months. Other folks want to talk about that?
Yep, Maureen, I'll jump in, because I think what you say about learning is resonates with something I was thinking, and that was it's not easy. It's not easy to take that seat at the table, and people are not necessarily going to welcome you. So I would encourage people to dive in head first, expect to be beat up a little bit through the process. That it's only that's going to build your muscle and build your leadership muscle. And the sooner you start, the faster your career is going to progress.
Fantastic advice. Go ahead, yours.
So I would recommend to adopt the behavior of a leader. So be involved, accept challenges, because sometimes you will never feel that you are ready, but you are. So accept challenges and learn from, as I said before, from any mistake, but just go on. Go for what you feel is the best to do.
Thank you. We're all saying you need a little bit of courage, I guess, but and it's hard to have when you're still in your early learning phases. We had another question about a student nurse who was exposed to COVID and developed an autoimmune condition, so can't work directly with patients now. What advice do we have on no or limited direct patient contact, research, public health policy? You know, what would you advise somebody who has the passion for the profession but can't be in direct contact with patients? Erica and then Bongi.
I'll just say really quickly, I think that this panel is a perfect snapshot of all of the things that you can do that are not necessarily clinical. And again, going back to, what I said about, never knowing that there were any of these career choices. In my undergrad, I remember thinking, so is it ICU, is it public health, maternity or med surg, sort of what do I choose? And so just the more you start to uncover about the different career possibilities, the more you find. And I don't think necessarily nursing was, well, in my experience, we weren't that good at, sharing all of the possibilities in nursing. And I think, Maureen, you also said this, that comes a bit from the fact that there weren't that many opportunities historically. And so as the nursing profession advances and grows, we're seeing nurses in more and more areas where we were not traditionally. So certainly, bedside is not your only choice, as you can see from this panel. So don't give up on that. There's absolutely tons of opportunities out there for you.
Great, Bongi.
So I didn't get all of what Erica said. I think there's sound problem with my computer. So I do apologize if I do repeat. But what I'll say is that nursing is a very diverse profession. There isn't any profession that I'm aware of under this earth that is as diverse as nursing. And you can think about other jobs, such as in IT, so information health records, developing some expertise in that area, or even taking a master's that's relevant to that area, going into management, so thinking about MBAs, that's concentration in healthcare. You can think about research, so which is not direct contact with patients, but research that will involve you maybe in the data side of things, and in the recruitment things, or in the analysis. So they're quite a diverse of either managerial roles or roles in policy. And I'm sure you will know from doing your own analysis of who you are, what really makes an impact for you, what really makes you drive, besides the clinical practice, and work it from there, and look for mentors, get the support that you need to help you diverse and pivot your career to the next level.
Thank you so much. So as we wrap up, first of all, I loved working with you all. The panel was fantastic. Different parts of the world, different parts of our careers, different parts of health and healthcare. And just putting us all in the room, I think, does give people a vision about what's possible. And I hope what we did this morning was just open some doors for you. I think what we talked about is really, sometimes it takes courage. Make a little asset map with all of your connections and start to build connections. Realize that as Peter had said, whatever you think you're going in for is unlikely where you're going to end up, and we're all living proof of that. But thank you all for your wonderful comments and your reflections, and we have a great wrap-up session in just a few minutes, so I want to thank everybody for being with us in this clinic, and say good luck to everybody. We're all with you. Thank you.
Bye.